All right, good evening, everyone. I am Wendy Myers. I'm one of the senior clinical managers at Cancer Bridges and oversee the counseling program, the support groups, and the bereavement program. And I get the opportunity to oversee some wonderful graduate students. And tonight we are lucky enough to have one of our graduate students present this evening. I'd like to introduce Samantha Swaderer to you. And when we were talking about, what topics to choose to talk about, we both kind of came up with a topic I think all of us are probably dealing with in the last couple weeks, whether it's from an illness or from anything going on in your life, but even just from all the election craziness going on over the past couple days. So I think Sam's lecture is at a very timely time for us. And so I'm excited that she's here to present, and she's going to tell you a little bit about herself because she has a great background, and she's going to be one heck of a therapist as she is already. But we're glad to have her here. So welcome, Sam.
All right, thanks so much, Wendy. So yeah, my name is Sam. I'm a counseling intern at Cancer Bridges. I'll actually be graduating from IUP this December with my master's in clinical mental health counseling. I've been at Cancer Bridges since May of this year, and I've had the honor of working with quite a few of the members in one-on-one sessions. Additionally, I come with about 13 years of pharmacy experience. I'm currently the inpatient pharmacy purchaser for one of the AHN hospitals. And I've worked within the AHN network for, oh my gosh, 5 or 6 years now at this point. I used to work at Allegheny General, and I helped to establish their Meds to Beds program there, which assists patients who are being discharged with their prescription needs, addresses any insurance coverage issues or any cost issues. I've not experienced cancer myself, but like many of you, I'm sure, I've had loved ones who have experienced cancer, as well as pass away from cancer. So I feel very honored to be with everybody today, and to talk about this topic, which I don't think anyone can escape anxiety. So let me go ahead and get my screen shared here. And we will pop right into it. All right. So throughout my time at Cancer Bridges counseling members, this topic of anxiety has been really reoccurring. I'm sorry. Oh, no, we're good. Okay. There's so many things that feel scary and out of your control. So today we're going to talk about anxiety to help put some of the power really back into your hands. We'll talk about what anxiety is, symptoms, how it might manifest within your body and your mind. We'll learn about what exactly is happening within our bodies when we experience it. And then we'll share some tools to sort of help ease you through that experience. I just wanted to write down a couple of quotes that I heard a lot of throughout my time counseling. A lot of people experience anxiety. They feel as though they're fighting for their life. They're not able to shut their mind off. Some people end up feeling really disconnected. A lot of people say that they feel like they're waiting for the other shoe to drop, struggling to find the good. The topic of or feeling of pressure is really prevalent with a lot of people. Some feel like they're frozen. Others just feel helpless watching their loved one suffer and experience the diagnoses. And some even feel like they have a hard time catching their breath. So what is anxiety? So according to the American Psychological Association, anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes. It's not exactly the same as fear, but often they're interchangeable. So anxiety is considered a future-oriented, long-acting response focused on a diffuse threat. And fear is more of an appropriate, present-oriented, and short-lived response to a specific threat. It's something that everyone experiences. Unfortunately, in life, we're not able to get away from it. But people experience anxiety over small and large things. Some experience it regarding finances, public speaking, job interviews, and then a cancer diagnosis, to just name just a very few. However, just because it's a normal emotion, that doesn't mean that it's enjoyable. So even though it's a part of life that we're unable to escape, having knowledge about it can empower us to face it and sort of move through it. Some of the common symptoms of anxiety, and these are just some, not all, is the feeling of fear, dread, or uneasiness, trouble sleeping, an inability to stay calm or even physically still, cold, sweaty, or tingling hands or feet, shortness of breath or increased breathing, an increased heart rate, dry mouth, dizziness or feeling weak, racing and or fixated thoughts, inability to concentrate, and a fear of objects or places. So some of the manifestations of anxiety when we're considering that in relation to our bodies and our minds. So one, it can manifest in our brain. Some people experience a sense of doom, which may cause difficulty concentrating or focusing. Some people will experience headaches from the constant worry and stress. Panic attacks are a little bit more of an extreme manifestation, but some people experience that, which can include palpitations, chest pain, and lightheadedness. Depression is also one, and it can manifest by social withdrawal, a loss of interest in activities, and feelings of guilt or hopelessness. Extreme fatigue, which might even compound what we're experiencing as far as side effects of chemo or some of the treatments that we're going through, just feeling really wiped out at various points throughout the day. And even though you're extremely fatigued, that coupled with sleeping problems might seem a little strange, but the two do go together. And also just an irritability that you feel like you might not have control over. It can manifest in the chest and stomach. So you can experience breathing problems, rapid, shallow breathing, which can be more intense if it goes so far as to happen during a panic attack. A pounding heart, which may quicken in pace or intensity, can occur with the panic attacks or on its own, but that alone can be really scary. And an increase in blood pressure, which can manifest in certain ways. Oddly enough, people don't think about this, but it can also manifest in our pelvic floors, muscles, and joints. It's not something that's just felt mentally. You can experience muscle pain. Some people experience muscle twitches. And a lot of women experience pain and issues with their pelvic floors. And sometimes that can even be coupled with, or a loss of libido can just sort of stand on its own. And next. So what's actually happening in your body when you're anxious and in survival mode? So a lot of members have talked about how their cancer experience or journey, I know people call it different things, but they describe that it's sort of like war, especially when you're experiencing it in more acute stages. But what exactly is happening when we're dealing with more acute or intense anxiety, or we feel like we're in survival mode? Our sympathetic nervous system is activated. And the sympathetic nervous system is a network of nerves within the body that prepares us for physical activity or a fight or flight response, which we also know includes freeze or fawn. There's a couple different ways that might manifest depending upon how you personally experience it. Adrenaline and noradrenaline are released. Other technical terms for that are epinephrine and norepinephrine. And adrenaline is a hormone that keeps the body prepared for stressful, dangerous, or exciting situations. Not always a negative thing. You hear people talk about adrenaline junkies, but when we're talking about anxiety, it's not necessarily helpful. The noradrenaline is a chemical that helps transmit signals to nerve, muscle, and organ cells. And it tells those cells and organs what to do in response to the stimuli we're experiencing. Blood pressure and heart rate can increase along with our breathing rate. Blood flow increases to the heart, lungs, and large skeletal muscles, which means it's decreasing in other areas of our body. Glucose and fats are released from storage to increase our blood sugar levels. Sight and hearing become sharper. Our pupils may dilate and the skin may flush or become pale. The brain is really in survival mode, which is putting us into a primitive state. And so when we're in a primitive state, our abilities become limited. So it's not uncommon to feel as though we actually can't think clearly. We can understand how being that in that state could have been helpful before modern times, but today we're typically not fighting for our life against things like animals, famine, and the elements. So we want to get out of survival mode and move through those feelings of anxiety as swiftly as possible. So what can we do to ease our anxiety symptoms? Um, we can get good sleep, which a lot of times is easier said than done. So we'll talk about that one more in a minute. We can practice mindfulness and engage in physical exercise when we're able to and cleared by a doctor to do so. We can practice having a positive attitude, which might sound strange, but hope and positivity is really a mental muscle. So when we're used to thinking in a certain way, our brain becomes trained to think in those patterns, and we need to work on rewiring those pathways. And this can be really challenging, especially when we're faced with such a devastating and serious diagnosis like cancer. Um, and practicing positivity and gratefulness. It doesn't mean that we want you to fake anything. Toxic positivity is a topic that's been talked about and a term that's been used a lot more in recent years. And it is actually harmful because it rejects that anyone experiences difficult emotions, and it shows a favor to being cheerful or putting on a positive facade. Uh, so we definitely don't want people to do that, but to spend a little time each day, even if it's just a minute before bed, to be grateful for something, no matter how small, can really end up making some differences. And it doesn't even have to be anything major. I'm grateful I saw such a beautiful sunset today, or I'm happy I was actually able to take a restful nap this afternoon. We can journal. It's not for everybody, but it's really helpful. We can attend support groups, eat well-balanced meals, and practice grounding exercises. So sleep hygiene, that's a term as well that has become more clinically studied and more used in more recent years. But good sleep is challenging for a lot of people. And just because you're sleeping, it doesn't mean that it's good, restful sleep. So here are just some tips to practice when you're looking to get better at your sleep hygiene. So focus on your environment. Some people like to do blackout curtains or use an eye mask. Establishing a regular sleep schedule, going to bed at the same time every day and waking up at the same time every morning. Even on weekends, as much as you're able to manage, it might not sound like the most fun thing, but with sleep being such an essential part of staying healthy, having a little bit more discipline to do that can really go far. Avoiding large meals before bed so your digestive system isn't as active. Avoiding screens for 30 minutes before bedtime because the light actually hinders the body's natural melatonin production, which assists with sleep. Avoiding disruptive substances as much as possible. This includes nicotine, alcohol, and caffeine. I know a lot of us can't get away from our morning cup or cups of coffee, but limiting how much we're intaking and when during the day we're doing that can really help. If you do struggle with sleep, trying to do a calming activity before bed, taking a bath or a nice hot shower, journaling, or even practicing some form of meditation, and making relaxation the goal at the end of the day. Because if we're so focused on achieving that sleep, that can actually cause more anxiety, which is sort of working against what we're trying to do. One thing that I wanted to bring to everybody's attention is something called the Balance app. Um, it it's something that I personally use. It's been very helpful for me. Um, and what's really wonderful about it is that it offers a free trial of a full year before they make you pay for anything, which I have found to be really wonderful because if you're like me, I like to save money anywhere that I can. It was named Google's App of the Year in 2021, and it contains everything from soothing sounds to meditations and grounding exercises. I know a lot of people might say, oh, meditation's not really my thing. But I would say just give it a try. They have all different kinds, so not all of it has to be you're walking through an immersive forest experience, but it's really a wonderful app. And the more it's intuitive, so the more that you click on certain things and do certain exercises, it'll give you suggestions for other ones to pop up. So I've included that link in the slideshow. And I do believe that this presentation will be put up on the Cancer Bridges YouTube page. So you can always go back to reference that if you would like. So exercise. So as with any exercise, I do want to preface it by saying make sure you're cleared by a physician to engage in physical activity. This will definitely look different for everyone. But I wanted to put that out there because depending upon your diagnoses or other maybe comorbidities you're dealing with, certain exercises might not be doable for everybody. Um, but I wanted to touch on it because it doesn't need to be training for a marathon or taking a high intensity spin class at a local gym. Simply going for a 10-minute easy walk outside can be effective. Um, it reduces stress by positively affecting the central nervous system's response to that stress. It releases endorphins and then reduces cortisol levels. So it's really using both sides of your brain to sort of regulate those feelings that you're experiencing. I also included easy somatic yoga. Um, it's a really helpful option, especially for those who have had some more traumatic experiences or really heavy emotions surrounding their cancer experience. Um, there are all different kinds of somatic yoga out there. It does vary in levels of ability and intensity, but it can absolutely be done on a much lower impact. I did include a link. Again, you can be referenced whenever the presentation is posted. But this one can actually be done in bed or just on the floor. No getting up and down, nothing that might induce any sort of vertigo or dizziness. Um, but it can be really, really helpful. Um, Somatic yoga in and of itself focuses on internal awareness and really releasing tensions. It allows the brain and muscles to move more effectively and overall just calm your central nervous system that can really help with the anxiety that we experience. So next we're going to talk about breath work. And I know some of you may be thinking, she did not just tell me to breathe and everything will be okay. And no, I'm not. However, breath work is clinically and scientifically proven to help. So why does it work? The oxygen. And it's sort of like, duh, we need oxygen to exist. But the brain makes up 5% of our body, which is not a big percentage. However, for such a small percentage of space, it requires 20% of our oxygen intake. So what happens, we sort of will talk about the survival mode piece, is that whenever we get anxious, our breath can become more shallow and increase. And what that does is it decreases our oxygen intake, which throws us into that survival mode. So by taking some time to do a little bit of breath work, it increases the oxygen to our brain, which activates the autonomic nervous system, which works to pull the body out of survival mode and regulate all systems to work together really calmly. One of the techniques, and this one I was actually turned on to by Wendy, has actually been my favorite, and it's the 4-7-8 technique. So with this one, you breathe in for 4, and you hold that breath for 7, and then you exhale for 8. And the reason why I personally like this one so much is because I find it particularly helpful when feeling more acute emotions, experiencing racing thoughts, or perhaps even dealing with catastrophizing. The holding the breath for 7, it's just a little bit challenging. It's not something that our bodies are really used to doing. So it makes us concentrate a little bit more. And what that does is it sort of, it slows us down, calms our nervous system, and then brings us to a place where we're really focused on the here and now. So lastly, we're going to talk about some grounding techniques. And This can really, additionally, as well as the breathing techniques, can calm us and root us in the here and now, which is particularly helpful when experiencing those racing thoughts, catastrophizing. Grounding techniques, there's quite a few different ones. I think a lot of people, when they think grounding techniques, they think about walking around outside barefoot, which I enjoy, but it's not always feasible for everybody, nor does everybody really want to do that. So there's a lot of different strategies that can help you to connect you to the present moment. Again, like I said, can help with those negative and racing thoughts, and it helps to quiet those extreme emotions, particularly if we're experiencing any traumatic memories. That can be from a particular treatment you've experienced, or even dealing with a traumatic loss and an anniversary of that, which a lot of people might experience. So a couple techniques. One is the 5-4-3-2-1 technique. And so this one is really going to focus on our senses. And so you'll start by naming 5 things that you see. So you'll say, I see my television, I see my dog on the couch. You'll name 4 things that you feel. I feel the soft cotton of my socks. I feel the warmth of the blanket. 3 things that you hear. I hear the wind outside because the window's open. Something that you smell. I have a vanilla candle burning. And then 1 thing that you taste. I taste the honey from the tea that I was just drinking. If it's too acute, the feelings that you're dealing with and the anxiety at the moment, you don't necessarily have to stick with the 5-4-3-2-1. You can cycle through the feelings and just say 1 thing you see, feel, hear, smell, and taste, and continue to do that until you're in a more calmer space. Another one is focusing on touch. Touch is really important for a lot of people when it comes to bringing us to the here and now. Something like placing your hands under running water, alternating between warm and cold every 30 seconds for each. And then additionally, touching different parts of your body, either pressing down or lightly squeezing and releasing for 30 seconds each. You can do that with your hands clasped together, give yourself a hug, press down on your thighs, and that really helps to regulate. This is something that isn't always just helpful for anxiety. That's a technique that is used a lot for people who are on the autism spectrum. It's very regulating and can be really helpful for a lot of people. So what if my anxiety feels a little bit unmanageable? I've tried these techniques, they don't seem to be helping, or most of the time they don't help me. What do I do? Anxiety, absolutely, like a lot of other things, has the ability to develop into a disorder. Sometimes it doesn't go away and can get worse over time. And when to seek help is when it honestly becomes clinically significant. So, what does clinically significant mean? So that means when it interferes with your ability to do daily life activities. Some people even say, like, I feel like I can't feel. The threat is so intense or so consistent that the protective mechanism shuts down our nervous system so that you can't feel or connect with things. I like to think of this as the old phrase, playing possum. Within our body, there's something called the vagus nerve. And what that does is that it carries signals between your brain, heart, and digestive system. So when we exist in that hyper anxious survival mode for too long, we can experience a prolonged freeze state. This is known as dorsal vagal shutdown. And this shutdown slows down the body internally to control energy. But a person may feel frozen, helpless, disconnected, or even depressed. So, how do you seek help if you're experiencing something like that? So, the 2 main ones that I like to talk about is psychotherapy, which is just a fancy term for talk therapy. And many different kinds can be helpful, but there are some that are specifically helpful when dealing with anxiety. So I always suggest that if you are seeking a clinician to help you with that, some that are really helpful is something called cognitive behavior therapy, or CBT. Someone that deals with or has a lot of experience handling clients that have experienced trauma, or even more specifically, those who have experienced some cancer in some way. and then eye movement desensitization and reprocessing, which is becoming more commonly used. A lot of clinicians are getting certified in this. It's called EMDR, which might be a little bit more known of a term. But this is really when you are experiencing a lot of trauma surrounding your anxiety, and it's shown itself to be really clinically significant when treating those. And the last one is just really to speak with a physician or psychiatrist. And this could be your PCP, your oncology team, or someone that you find independently. Um, Talk to them, see what they suggest, and if necessary, medication is available if deemed appropriate by that specific provider. But reaching out for help, it's really not a weakness. It actually shows strength because we're admitting that we don't know it all. Nothing prepares you for cancer and the stressors and anxieties that come with that. So it can be really, really challenging. There are the references if needed. So I will stop sharing here. But I did just want to thank you all for sitting through that. I know there were some more medical terms and moments in the slideshow, but I guess now I just want to take the time to open the group up for discussion. Has anybody experienced anything that I presented, or have any topics specifically resonated with you? Or does anybody have any experiences with anxiety they want to share, or even share any coping skills?
Sam, thank you. That was amazing. I'm going to
Yeah.
stop recording and bring everybody back so that they feel comfortable not being recorded, sharing their responses. So hold